I'm Ben McBean. I am an assistant claims manager at QBE Insurance. My journey towards diagnosis and our family experience of autism or neurodiversity was that my eldest son, when he was 5 years old, the school contacted us and they actually asked us to come in to speak to them because they had concerns about his homework, but it actually transpired that they thought he was autistic. So we then had a period of time where we tried to understand what autism was. Whilst we were going through that process, which initially was about 2 years for assessment, our youngest son was born, and it was quite clear to us that he was possibly autistic as well, because he was a prolific climber. He'd always escape from wherever we were. He had no fear. His language was very poor, and he'd eat human hair as well. Eventually, he and my eldest were diagnosed roughly about the same time. He was diagnosed with autism and ADHD, and my eldest was diagnosed as being autistic. Then about sort of 2016, I felt that I was suffering depression, and I thought that I'd dealt with it, and it wasn't a problem. But it was quite clear by 2019 that it was actually worse than I thought. And I got to a stage where I couldn't sleep for about 3 weeks, and it was quite difficult because I couldn't switch off, and I was stuck in my thoughts going round and round without being able to turn off. So it got to the point where it was thinking of sort of drastic ways to stop that. But eventually I got to the point where I realised that potentially it was due to autism. So I ended up on the pathway for autism assessment. I was on referral also with a mental health nurse as well, just to make sure that I wasn't suicidal and keep a check on me. But it was very hit and miss. She wouldn't get in touch with me when I expected she was going to. So it felt a bit like I was left on my own, struggling every day to try and keep level-headed. But eventually she just suggested that I could have ADHD as well. So I ended up on the pathway for that as well. And finally, after 3 years, I was diagnosed as being autistic and ADHD. I've had various opportunities to advocate for myself and my family and others, because a lot of the experiences you have, which is common to all families, is you're faced with a constant battle really to get equity. And in fact, my eldest son didn't get a statement as it was at the time because the school hadn't supported it. And we eventually, when we did get an education healthcare plan, they didn't actually put in the required provisions. So within a couple of hours of the deadline for them to pull out of the dispute that we had before an actual tribunal, they did so at the very last minute. So I've been in that situation a couple of times. We've also had challenges with CAMHS as well. So my youngest son was referred to CAMHS because of our concerns about danger to himself and things that he would say about that. And he was on referral. He'd been on the waiting list for nearly 12 months when lockdown happened, and there seemed to be a countrywide instruction for CAMHS to discharge all children from the waiting list. We complained about it because obviously we were concerned about our son's health, and they wouldn't even entertain interviewing him or us virtually. So I complained to my MP and the PALS service as well, and that went to Nadine Dorries, who was the Secretary for Patient Safety and Suicide Prevention. I was determined to ensure that my son was seen, which is what happened. I also got in touch with Dr. Paul Williams in 2017. He was running for MP in our local area, and he was a GP. And at the time, diagnosis in Middlesbrough, which neighbours where I live, was about 8 months. But in our area, it was 3 years. So I flagged that issue to him, and when he became the MP for our area, he took that on. So I then worked with Paul Williams for the period that he was in office, and managed to get the waiting list down to about 2 years for children. We also set up myself and my now ex-wife set up a Facebook group to support other parents, because we realised that most of the benefit we got from speaking to other people and other parents would be useful to other people, and it was probably the most beneficial thing that we experienced. So we started that Facebook group, and eventually, because it was so successful and we wanted to be able to provide a lot more support to people, we became a charity in 2019. So we support about 2,500 people in our area every year with leisure activities for the children, so they can meet other children as well, respite for the parents and carers. And also I started a legal qualification for SEND as well, because I have a legal background, and we wanted to be able to provide other parents with guidance on how to ensure they can get the right provision for their children at school. So I got the IPSI qualifications, levels 1, 2 and 3. More recently, I've also been involved with my new MP. He intervened in the recent debate in Parliament on autism and ADHD diagnosis, and he'd asked me for input on how he could position his speech, and he also talked about my story as well.